healthy eating and regular exercise are not enough to keep your blood glucose level in its target range, you may be prescribed medications. There are several kinds of diabetes oral medications. Each kind works in different ways to control your blood glucose level. The pills in the sulfonylureas class help your pancreas release more insulin. Remember, insulin makes it possible for cells to take in glucose to be used for energy now or stored for later use. The pills in the meglitinides class and the diphenylalanine derivative class help your pancreas release more insulin after you have eaten. The medications in the biguanide class help keep your liver from releasing too much glucose into your bloodstream. This can help keep your blood glucose from going too high. The pills in the alpha-glucosidase inhibitors class slow the digestion of carbohydrates in the foods you eat. This helps glucose enter your bloodstream more slowly than it normally would. The pills in the thiazolidinediones class decrease insulin resistance by helping your cells become more sensitive to your insulin. This makes it easier for your cells to remove glucose from the bloodstream for energy. There are also 3 medications that combine 2 pills into one. Glucovance and Metaglip help your pancreas release more insulin and help keep your liver from releasing too much glucose into your bloodstream. Advandamet helps keep your liver from releasing too much glucose into your bloodstream and helps your cells become more sensitive to insulin. Any medication has side effects. Common side effects of diabetes medications are diarrhea, abdominal pain, bloating, headaches, muscle pain, and weight gain or loss. Let your doctor know if you are experiencing any side effects, but please do not stop taking them until you discuss your concerns with your healthcare team. If you are taking metformin, rosiglitazone, pioglitazone, glucovance, Metaglip, or Advandamet, the health of your liver and kidneys should be checked. People with congestive heart failure should not take rosiglitazone, pioglitazone, or Advandamet. If you are taking metformin, glucovance, or Metaglip, be aware that these medications can make you sick if you drink 2 to 4 alcoholic drinks a week. If you would ever drink more than that, tell your doctor. Also tell your healthcare provider if you are taking any of these medications before having an X-ray using contrast dyes. Incorporate taking your medications into your daily routine by keeping track in your blood glucose record or a calendar. And be sure to organize your medications to help you to take them as prescribed. It may help to use a pill organizer. It's a good idea to have all of your prescriptions filled at the same pharmacy, because they can keep track of your medications and inform you of which ones may be harmful when taken with another drug. Also, make a copy of your updated list of medications to give each doctor you visit.
For some people with diabetes, taking oral medications is a necessary part of the treatment plan. Knowing how they work and developing a system to help you take them as prescribed will help ensure their effectiveness. Were you able to identify the type of medication you are taking and understand its action? Do you have a system for helping you to remember to take your medications? If you haven't already done so, make a list of your medications and dosages to take with you on each diabetes care team visit.
To keep your blood glucose in your target range and avoid long-term complications, you may need to take insulin.
Going on insulin doesn't mean that their diabetes has gotten worse. The bottom line is whatever their blood sugar is. And so we're trying to get their blood sugar as close to normal as possible.
Your doctor or nurse practitioner will recommend the type, dosage, and times or frequency of injection for your insulin. It's a good idea to know or keep a written record of this information. There are several different types of insulin used to treat diabetes. They are rapid-acting, short-acting, intermediate-acting, and long-acting. They are grouped into one of these types based on the time of action. Their onset, how quickly they begin to work to lower your blood glucose level. Their peak, the time they are working the hardest to lower your blood glucose. And their duration, how long they work to lower your blood glucose. It's important to know which kind of insulin you use and understand how it works. The onset of rapid-acting insulins begin very quickly, usually within 15 minutes. These insulins peak at 30 minutes to 1.5 hours, and their duration is a total of 3 to 4 hours. Since these insulins begin to lower your blood glucose almost immediately, you must be ready to begin eating your meal before you inject it. Otherwise, your blood glucose could drop too low. The onset of short-acting insulin is about 30 minutes to an hour after injection. Its peak is at 2 to 3 hours, and its duration is 3 to 6 hours. The onset of intermediate-acting insulin is in about 2 to 4 hours. Its peak at 10 to 16 hours, and its duration is 10 to 18 hours. One long-acting insulin called ultralente has an onset after about 6 to 10 hours. Its peak is at 10 to 16 hours, and its duration is 18 to 20 hours. The other long-acting insulin, glargine, has its onset in a little more than an hour, and continues to work at the same level for up to 24 hours. This means that, unlike other insulins, insulin glargine doesn't peak, or have a shorter period of time when it's working its hardest to lower your blood glucose. It's important to take insulin glargine at the same time every day. Most people take it at bedtime. Many factors, including the type of diabetes you have, your age, your weight, and your lifestyle, will help you and your diabetes care team determine which insulin or insulins will work best to help you keep your blood glucose in your target range.
It's just something going on every night.
Some people inject 2 insulins, a shorter-acting and a longer-acting insulin in the same syringe, to help even out the blood level throughout the day. These are called mixed doses, and may be mixed by hand, or they may come pre-mixed. Be aware, however, that insulin glargine cannot be mixed with other insulin in the same syringe. The more you know about your insulin, the more likely you will use it safely and effectively to help keep your glucose in your target range. Recording your blood glucose at specific times will help you figure out when your insulin begins to work, when it works hardest, and for how long. In the past, insulin came from cows and pigs, and is still produced on a limited basis. However, most insulin today is created in a laboratory, and is so much like your own, your body can't tell the difference. It's called human insulin. Check your insulin before using it. Make sure it's the right type and brand, and that you know your proper dose. Extra insulin should be kept in a cool, dark place like a refrigerator door. Never store your insulin in a place that is too hot, or where your insulin could freeze. The insulin that you are using can be stored at room temperature for 28 days. Check your supplies on a weekly basis to make sure you have enough for at least 2 weeks, in case you can't go out because of bad weather or illness. Check the expiration date on the label before using it. Do not use your insulin if it has expired, or if an open bottle is older than 28 days. Some insulins are cloudy, others are clear. Cloudy insulins need to be mixed gently prior to use. If a cloudy insulin is clumped or the glass looks frosted, it should not be used. If your clear insulin appears cloudy or discolored, it should not be used.
Needing insulin does not mean your diabetes has gotten worse. The more you know about your insulin, the easier it will be to maintain your health. Do you know the type of insulin you are taking, when its onset is, and when it peaks? Do you keep a written record of what type, when, and how much insulin you take? Take some time now to identify places in your house or office that are best for insulin storage, and check to make sure you have enough supplies on hand.
Talk with your diabetes care team about how to inject your insulin. Methods of injecting include insulin syringes, pens, and pumps. Because syringes and pens are used most often, this video includes information on these two methods. Insulin syringes are smaller, their needles sharper, and are easier to use than ever before. This helps lessen the pain of injection. Here are some important points to remember when preparing to inject insulin with a syringe. U100 is the standard for insulin used in the United States. That means each cc contains 100 units of insulin. A 1 cc syringe holds 100 units of insulin. A half cc syringe holds 50 units of insulin. And a 3/10 cc syringe holds 30 units of insulin. You'll want to choose the syringe that's closest to, but higher than, the number of insulin units that you will be injecting. For example, if you must inject 40 units, then use the half cc syringe